ignoring your pain will not work. In fact, it will make it worse. Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Appreciate you checking out this channel. And in this video, I want to talk about how people are trying to more and more, as people learn about the role of the brain in pain and the mind on pain and things like that, people just chalk this up to, well, I'll just ignore my pain, Dr. Charlie, and that's what you're telling me to do, right? I just try to distract myself. I just try to not pay attention to it. But all this ends up doing is reinforcing that what you're avoiding and or ignoring in this case is actually threatening or dangerous to your body. So I want to have a brief chat about this, and that alone is a nugget in and of itself. And so it's like, hey, if you have some type of back, butt, or sciatica problem and you are ignoring your pain, trying to constantly preoccupy yourself or distract yourself from the pain, thinking that it will go away, recognize that you actually could be causing it to stick around longer. Oh, and real quick, if you are watching this video and you are interested in figuring out what you might be ignoring, meaning what is the cause of your pain, then go ahead, check out my Better Than an MRI DIY Diagnostic Guide, where I outline my entire decision-making framework for figuring out the most likely source of your back, butt, or sciatica problems. And so, what does ignoring do, right? So when we say, I'm going to ignore my pain, that's a conscious choice, right? And the conscious choice, the choice to ignore something, to turn your face from something, reinforces through that choice that you're acting from a place of fear, right? Because you don't ignore something that you're somehow not bothered by or worried about or fearful of, right? And so in this case, it might be your pain. It might be your back pain. It might be your leg pain. It might be your butt pain, right? And so if you're watching this video and you're trying to ignore your pain, you're trying to distract yourself from your pain, and you're not seeing the results that you're looking for, or better yet, you're trying to let go of your pain, then you will reinforce psychologically that which you're trying to let go of needs to be letting go of. Letting go of, letting God of. Sounds like a song or something like that. And so a little nuanced, right? But the idea is, look, be, do, have. If you're being someone who's consciously trying to ignore your symptoms or push them away or close your eyes to them or let them go, it means that in some way, shape, or form that you're not okay with them, that you're not accepting of them, that you're afraid of them or angered by them or annoyed by them or frustrated by them. There's some reaction there. Right? Instead, here's what I'd recommend you do. You respond to your symptoms. You respond by attempting to watch them, observe them, and confront them and challenge them from a place of observation, from a place of curiosity, from a place of lightheartedness. And here's the deal. Most of the symptoms that people experience, especially as it relates to chronic back, butt, and sciatica type stuff, aren't actually due to physical damage in the body. And so a lot of times, right, we interact with this pain, this lion, if you will, as if it can bite us at any moment, as if the symptoms that we're experiencing are due to physical damage in our body. When we feel pain in our butt, man, it must be a nerve I'm compressing. We bend over and we feel sharpness or a tightness or a pull down our leg. That's my sciatica flaring up. That's the joint, that's the disc, that's the stenosis. But is that really true? And maybe it is or maybe it isn't. But either way, learning to psychologically view your symptoms through a lens of safety versus threat will have profound impacts for you. I guarantee it, especially if you've been stuck in pain for more than 6 months and you're struggling to find relief. And so, if you knew that lion, if you will, let's just say you're scared of lions. If you knew that lion was behind thick glass, 6 inches of glass, solid glass, could you put your nose up to the glass and could you look at it in the eyes, or could you not? Right? If you want to get over your fear of heights, let's just say, or maybe your fear of spiders. I just saw a spider run by. You can't do that curled up in your bed in the comfort of your own home. You have to go to the cliff. If you're afraid of spiders, you can't just look at butterflies all day. right? You might start by watching some YouTube videos of creepy crawly things. Then you might show up in real life. Go to the pet store and see a tarantula or something like that. Then eventually you get to the point of holding them, walking around in the jungle with them, etc., right? You start at a small cliff if you're afraid of heights, and you build it up over time. But ignoring the fact that you are afraid of heights, or ignoring every spider that crawls across the road, won't get you over your fear of those things. And so again, this goes back to the idea of, look, if you're ignoring your symptoms, realize that that's a conscious choice, right? That's a conscious choice that you think might be a good way to get over things. But if you ignore, again, the monsters in the closet, if you never look in the closet, then you can never get over your fear of it. Of course, you're not going to be afraid of the monsters in the closet, right? If you never go look at them. But is that really true? No. In fact, it reinforces that you're even more afraid of them, and that's why you won't go open the closet or look under the bed, right? And so, if you're ignoring symptoms, my challenge to you is to, maybe you see them like a lion, maybe you see it like a tiger, or you see it as something unpleasant, something you're a little bit fearful of, worried of. Why not try to show up to it? Instead of sitting there, feeling some symptoms coming on in your butt, and getting up or grabbing for that soft cushion. Why not sit there a little longer? Is it possible my brain has made a bit of a mistake? Is it possible that the symptoms I'm experiencing in my butt right now as I sit here and watch Charlie's video, is it possible that it's not causing me damage? Instead, every time I get up and move, I'm actually training my brain to react to these symptoms. I'm reinforcing them. I'm proving to my primitive brain that I'm not safe. Otherwise, why would I grab the cushion? Why would I try to ignore these things? And so rather than ignoring, rather than looking for the softest seat in the room, rather than carrying that cushion around with you all the time, if you need it, you need it. But if symptoms are tolerable, challenge it. And I challenge you to challenge them. What is them? What is it? It is a sensation, right? Pain is an unpleasant sensory experience or sensation created by your brain to protect you from some actual or perceived threat or danger. Could you be perceiving danger when you sit, when you stand, when you lift, when you bend, when you walk? And every time you ignore it, every time you try to push it away or let it go, pretend like it's not there. It is there. And you can't fool your brain. It's smarter than that. It beats your heart when you're not even thinking about it. It allows you to breathe, and it's all subconscious. All right? And so you're not fooling anyone. You're definitely not going to fool your brain. In fact, the more you get up and run away from things, the more you try to push things away, the more you try to ignore things, the more you reinforce that which you're trying to push away, get rid of, ignore, is actually a threat to the system. And so what will happen is every time you sit, every time you walk, every time you get up, every time you go to bed, whoop, whoop, alarm will sound. Pain will persist until you retrain your reactionary response to it. Ignoring it is not the way. Instead, confront it, challenge it, show up to it, knowing that in most cases, especially if your symptoms are chronic, the pain that you're experiencing is not due to damage, but rather perceived danger. Something to think about, especially if you've been living a life of avoidance, because that's what ignoring things does. Again, if you don't go to the cliff, you didn't get over your fear of heights, but you might not feel afraid in the moment. But inside, you're still afraid. So show up to it, challenge it, and prove to yourself by sitting a little bit longer, by standing a little bit longer, by getting up a little bit more smoothly with less hesitation, that you can do this, that you can overcome this. And slowly over time, you reduce your fear. You don't ignore things anymore. In fact, you observe them, you look at them square in the eyes, and you challenge that which you've been led to believe. Pain may be due to danger, a trained brain, a very intelligent mind. You've got a good brain, not damage. Practice showing up to it over and over and over again. This is Dr. Charlie. Hopefully this was helpful. Let me know your thoughts below.